the open house. What we do is generally we would like to show our hospital to the doctors and the well-wishers and young parents to see that our facility has come up. So once the kind of clinical operation starts, then we shut the doors for all the kind of visitors in everyone. So that's why this is an important occasion for people to showcase the hospital to everyone. So I'm a pediatrician. I've done my pediatrics in Chennai as well. So in 1988 and 89. So I went to UK after my post-graduation and spent some time in UK. Done the specialty in the children's gastroenterology, liver diseases, transplantation. So came back to Hyderabad. That is the time I realized that we need a specialized children's hospitals, something like an Institute of Child Health, like ICH, like more child test hospital in the private sector also, because the cities are growing, the people number of people who can afford to private health care is substantially increasing. Based on that, I started in 2000 in Hyderabad. Started with 50 beds. And initial periods normally everyone goes through a new venture because we were all new into the city from coming from various countries. It took some time, but people understood. One of the important things why we were able to we made ourselves successful was that we used to work very hard for a child who is very sick, who is critical, the newborn who is critical. So we never counted our nights. Our endeavor was to save those sick babies and sick children. So that's actually created a huge impact in the city of Hyderabad for the young parents to believe that these are the doctors have come back with a different skill set and they're making the difference in many sick kids' lives. So that is the basis. That was our success. We started and ourselves with all the gadgetry suitable for the newborns and pediatric children was critical. So specialized pediatric and neonatal transport systems with a qualified neonatologist intensivists going around in Hyderabad city to 200 kilometers to the districts to go and pick up these babies so that nothing happens to these people. That's a huge initiative. Today we do the largest number of transports in the country by any other hospital. No other hospital does as many transports as we do, whether it's from Hyderabad or from Chennai or from Bangalore or from Delhi. So, every day, at least 2-3 half-hour doctors there all the time, an ambulance to go and pick the babies from various districts of this country around from our major cities. Next important thing is the building the strength in the intensive care services. In terms of giving a specialized treatments. Earlier, people used to do those things in adult hospitals with a expertise of the adult anesthesiologists. So when you have a ability to do in children's hospital with the pediatric specialty doctors, and that definitely gives us better results and also quick recovery. So we focused on the advanced ventilatory techniques, methods, nitric oxide, the high frequency oscillations, jet ventilation. There's so many innovations like ECMO services. All those things we have brought into those things have actually been taken up by all other hospitals, rest of the country also by the pediatricians, not only from the private sector, some of the trust and government systems also. There's been a huge encouragement for the rest of the people to do it. And recently, we started doing air transports. So the one is that earlier, though you have a affordability, and you don't have means of tending a sick child. Even if you have means and you don't have a specialized aircrafts or a specialized expertise to transport them, today from all over the country we are doing the transports right from the Bhutan to Myanmar to Goa, Raipur, everywhere. to all our centers in Chennai, Bangalore, or Hyderabad or Delhi. So that is another advance. Last 2 3 years time, the number of air pickups what we are doing are increasing. Another advancement what we have done is that the the children's super specialties. Like adults, we have children's super specialties. Chennai is the first city is actually which had a concept of a super specialties for children in the ICH, in the Institute of Child Health, Egmore. So now we have built these super specialties significantly in our hospitals across the group, and also we come to the stage of offering transplant services for children for who requires liver transplant, who requires renal transplants or bone marrow transplants, or complex heart diseases and surgeries. So in a 24 years time, we were able to move from 0 to 20. There's so much advancement. For example, Hyderabad hospital is 24 years now. We can see that in this Hyderabad hospital, it's a strength, it's the ability to kind of serve and also take care of the complexities to any mid-sized American hospitals. There's no less than that. I can very proudly say that our results, clinical competency, training, every possible things, we were able to equate it to the level of some of the American hospitals. So what we see is that this success, we don't want to keep it there. We want to replicate the similar success in Bangalore, which is in a way in Chennai. So Bangalore and Chennai are my main focus for next 2 3 years time to build the more specialty services, perhaps to build more number of beds. What the approach what we have taken is that now the hub and spoke model. But our cities are very large. Large in the sense that now traveling distance or traveling time more than distance is pretty long. So therefore, if you have one hub hospital, we need about spoke hospitals to cover the rapidly growing pockets of the city, so that none of them kind of have a kind of long period to reach hospital, especially in emergencies. This hub and spoke model actually is very, very important here because quite a lot of times we will be working at work, men are at work. The woman has to go take the child to the nearest place. The nearest place, if it is within 15 minutes of distance, then that means it's much easier, comfortable, and also that addressing that emergency is more efficient, effective. So hub and spoke model is something that what we are trying to expand in Bangalore and Chennai today. In Hyderabad today, we are close to 1,000 beds. We have one hub and 7 spokes in Hyderabad. In Bangalore, we have one hub and 3 spokes. We are expanding more and more in Bangalore. Now in Chennai, we have one hub and 2 spokes. I think we have plans to expand more in future as the need comes. We don't want to do something because number of beds are important. We recognize the need, we recognize the geographical importance, then we start working on those things. Similarly, the south seems to be kind of most important for us because we are in Hyderabad, Bangalore, and Chennai. And the 1/3 of the population keep moving between these three cities. And also that Andhra Pradesh is one which is a kind of a connecting state between the 3 states. Me coming from Nellore, I know that how many people come from Nellore to Chennai. The number of kids coming from Nellore to Chennai, whether it is Egmore or whether it is to a child trust or to our hospital, is phenomenal. I think over a period of time, we need to see that we need to build that connecting regional spokes. What I'm trying to see that these 3 cities are as the hubs, main hubs of the main capital cities, connect Andhra Pradesh through the regional spokes. We already have hospitals in Vijayawada and Visakhapatnam. Now we are doing in Rajahmundry. In future, we're going to do a Nellore and Kurnool. That way, these regional spokes will become an intermediary for all the emergencies in those districts. Can easily transfer them to the main cities like Chennai, Bangalore, and Hyderabad. So, therefore, that we will have a large population of this 4 states we can cover them very efficiently, very effectively, and so that none of the children or women in emergency situations and will struggle. This is our whole idea, to connect these cities, connect these regional schools, and also establish the advanced ambulance network. So next thing what we would like to do is that the only other place which we are planning to do is in national capital region, New Delhi. We already have a hospital. Now we have big plans to do a NCR region, the hub and spoke model, which probably will take another 4 or 5 years time. This is where we want it to be. So Chennai is very close to my heart because this has been my city for anything, right from movie to shopping or anything from childhood. So I still know Chennai more than Hyderabad because I can drive around Chennai, probably not in Hyderabad. So that is how in always childhood memories are much more stronger. Thank you. Thanks for coming. I pass the mic to Sanjeev. He can speak in Tamil.
Chennai's health for the kids are also very close to his heart. So his dream is to continue to expand over here as need comes. What started out off as building a child hospital 24 years back is now turned into a reality by being India's only publicly limited company in this space, right? And we're doing fantastically well in terms of technical capabilities, in terms of superiority in clinical excellence, and in terms of actually expanding into the regions where this type of excellence is required to treat kids. It's an investment service Dr. Ramesh is making into the city, and we will continue to do that to ensure that all kids are given the right and the best possible clinical treatment, irrespective of the regions that they are. Happy to take any questions if you have.
இங்கே வந்து எங்களோட ஹாஸ்பிட்டல் ஸோ அங்கே வந்து மேஜர் சர்ஜரிஸ் எல்லாமே அங்கே நடக்கும். அதே மாதிரி இப்போ வந்து ரீச் தான் முக்கியம். சார் சொன்ன மாதிரி இப்போ நீங்கள் எங்கள் கனெக்ட் பார்த்தீங்கன்னா கிண்டி மெயின் இருக்குங்க. கிண்டிலேருந்து 12 கிலோமீட்டர்ஸ் ரேடியஸ்னால் அதர் சைட் ஆஃப் த சிட்டி வந்து சோழிங்கநல்லூரை கனெக்ட் பண்ணியிருக்கோம். இந்த பக்கம் வந்து பார்த்தீங்கன்னா நார்த் சென்னைக்கு ஹப் மாதிரி அண்ணா நகர், ஸோ அண்ணா நகரை கனெக்ட் பண்ணியிருக்கோம். இங்கே வந்து எக்ஸ்க்ளூசிவாக வி ஹவ் பில்ட் அப் அண்ட் IVF இன்ஃபர்டிலிட்டி சென்டர் இங்கே ஃபஸ்ட்டு கொண்டு வந்திருக்கோம் சென்னையில். ஸோ திஸ் இஸ் வாட் வி ஆர் பிரிங்கிங் ஓவர் ஹியர் இன் additionally to all the specialties which we have in India. Women and children. We are a single specialty, women and children. ஸோ நம்ம வந்து கவர்மெண்ட்டை ரிக்வெஸ்ட் பண்ணியிருக்கோம். ஏன்னா ஹாஸ்பிட்டல் வராத வரைக்கும் இந்த டிராஃபிக்லாம் இருக்குது. ஸோ கவர்மெண்ட்டில் ரிக்வெஸ்ட் பண்ணியிருக்கோம். ஏன்னா எமர்ஜென்சிக்கு ஆம்புலன்ஸ் உள்ளே வரணும், போகணும், கொஞ்சம் ஸ்ட்ரீம்லைன் பண்ணணும். ஸோ அந்த சப்போர்ட் கவர்மெண்ட்டை கேட்டிருக்கோம், அவங்க எக்ஸ்டெண்ட் பண்ணுறேன். இப்போ இந்த லைனில் பார்க் பண்ணுறதெல்லாம் வந்து ஆப்போசிட்டாக பார்க் பண்ணிட்டு இருக்காங்க. அது கொஞ்சம் ரெகுலரைஸ் பண்ணணுங்க. மெட்ரோலையும் கேட்டிருக்கோம். இன்னும் நார்மலாக மெட்ரோ வந்து மெட்ரோ ஸ்டேஷன் பக்கத்தில் மட்டும்தான் பார்க்கிங் வைப்பாங்க. பட் இங்கே பார்த்தீங்கன்னா மெட்ரோ ஸ்டேஷன் திருமங்கலத்தில் இருக்குது. இதை வந்து ஒரு அடிஷ்னல் ரெவன்யூ மாதிரி தான் பார்த்துட்டு இருக்காங்க. பட் இட் இஸ் நாட் டு சர்வ் த பப்ளிக். அதனால் ஏற்கனவே ரிக்வெஸ்ட் கொடுத்துருக்கோம். நாங்கள் இந்த ரிக்வெஸ்ட்டை ஏற்று அவங்க கிளியர் பண்ணி கொடுப்போம். சார் பின்னாடி ப்ரொபோசல் ரோடு போயிருக்காங்க, நாங்கள் பேசியிருந்தோம். ஸோ கவர்மெண்ட்டை எங்கள் ரிக்வெஸ்ட் கொடுத்துருக்கோம், பண்ணித்தரேன்னு சொல்லியிருக்கோம். சார் இது வந்து சிங்கிள் ஸ்பெஷாலிட்டின்னு நாங்கள் சொல்கிறோம். பட் வி ஆர் சூப்பர் ஸ்பெஷாலிட்டி இன் சிங்கிள் ஸ்பெஷாலிட்டி. ஸோ நாங்கள் கார்டியாக் சர்ஜரி பண்ணுறோம், ரீனல் டிரான்ஸ்பிளான்ட் பண்ணுறோம். ஸோ NICU கேர், ICU கேர்ஸ் இருக்குது, NICU அட்வான்ஸ் ICU கேர்ஸ் இருக்குது, அட்வான்ஸ் PICU கேர் இருக்குது, க்ரௌட் ஃபண்டிங் இருக்குது, சப்போர்ட் பண்ணுறோம். பேரண்ட்ஸுக்கு நாங்கள் க்ரௌட் ஃபண்டிங் சப்போர்ட் பண்ணுறோம். எங்ககிட்ட எம்பேனல் இருக்குங்க, நாங்கள் கைட் பண்ணுறோம். அவங்க அப்ரூவல் ஆச்சுன்னா அதுக்கு சப்போர்ட் பண்ணுறோம். ஆமாம் சார், முதலமைச்சர் காப்பீடு திட்டங்க கவர்மெண்ட்டில் CM ஸ்கீமில் வந்து NICக்கும் PICக்கும் சப்போர்ட் இருக்குங்க. ஸோ அந்த எலிஜிபிலிட்டி க்ரைட்டீரியா வந்துச்சுன்னா நாங்கள் சொல்கிறோம், நாங்களும் கவர்மெண்ட்டுக்கு எழுதி கொடுக்குறோம். ஹெல்த் மினிஸ்டர், ஹெல்த் செக்ரட்டரிகிட்ட வந்து அப்ரூவல் வருதுங்க. நாங்கள் எங்கள் பேஷண்ட்டுக்கு சப்போர்ட் பண்ணுறோம். சார் நாங்கள் இது வரைக்கும் இங்கே வந்து
The success of organ transplantation is actually much better in children. That's because children are young, resilient, and the recovery is much faster. If somebody's organ is failed, give them, they recover much faster. The body is young, so they improve very well. For example, if you take liver transplant program, you have a most mature liver transplant program is there in Chennai. Earlier used to be global, now global is there, and the Rela Institute. Rela is my colleague in London. So we started in Children's Hospital in Hyderabad. So we produced 94% results, and Professor Rela produced 94% results for children. Adult maybe about 88, 90. Because adult will have a lot of comorbidities, all other problems will be there. Children won't come with a baggage. They come with one organ failure. So once you repair it, they'll be better. Most important thing is this is some of organ transplants are for life. For example, liver transplants for life. BMT once successful is for life. BMT transplant for cancers and those things, they're about 85 to 90% success. No, the children's overall transplant programs are complex surgeries, like children's heart surgeries. Once you repair the heart, they're fine for rest of the life. And they are going to live 70, 80 years. So that is the beauty of repairing anything in children. Complete repair whenever it's possible. So you're giving the life for about 70, 80 years. Versus 10, 15 years of adult. Adult we are only lengthening short time. The children are lengthening very long. The very important thing is that some of the things like wide screening in the Western countries, they give so much importance to the screening programs. We are also doing nowadays, it's all coming in both private and government. Screening programs is an important thing. Some of the congenital problems. For example, just to take one example of renal problems. Undiagnosed or neglected or poorly treated renal problems in children going into adult advanced renal failure by 25 years is almost 20%, which is like a childhood problems. If they are not treated or addressed, 20% of the total adult load is mismatched. That's quite a lot. If they have been treated when they were children, they would have been like normal individuals. So that's why children's healthcare is such an important thing. And we are going to address at in the early stage of life so that they would not only have a quality of life, they can be very efficient like any of us in future. Otherwise, it becomes a huge burden to the parents, society, financial, social. It's multifactorial. So robotic surgeries. So robotic surgeries definitely in future are going to be a kind of a routine surgeries in future. At this point of the time, robotic surgeries are done very efficiently and lot more cleanly for certain reasons, like prostate, some of the gynecological, some of the urological. Now people are used for donor resection of our liver transplant. But cost versus advanced laparoscopy is huge, 8 to 10 times. In the hands which are good laparoscopic hands can do equally good job with robotic. Price has to come down. I think we are waiting for the price. Price will come down once the patents are over in 5 to 8 years time. The robotic will become a reality and we can afford that easily. Until such time that paying that 8 times of the price is probably very expensive. In children's, we don't need to do because minimum surgeries are very, very efficient, very, very effective. We don't need to kind of wait, spend a lot of time on the robots, do the robots in children's surgery. But however, in future, yeah, shortly we are going to commence operations of Rainbow Children's Hospital, NAGAR. So this is the 80-bed hospital with a very modern hospital focusing on children's emergency services and maternal emergency services in the heart of the NAGAR. So this hospital is caters for emergency services and also neonatal intensive care services, pediatric intensive care services, the high risk pregnancies and low risk pregnancies, and also fertility services. So this is a quite kind of we have three hospitals in Chennai city. One in Gindi, which is a hub hospital. This is the largest spoke to kind of cover this population. We also have a hospital in Sholinallur. So what we realized in the last 24 years of doing a children's health care, Rainbow is India's largest children's health care and publicly listed company. And we have hospitals in Hyderabad, Bangalore, New Delhi, and Chennai, and Andhra Pradesh as well. So in southern states, what we have is about dominantly Hyderabad, and we are building in Chennai and Bangalore. So these hub hospitals and also be connected through the Andhra Pradesh and the regional spokes. The whole of South, there will be kind of a very strong presence of Rainbow Children's Hospitals to cover all the pediatric and maternal emergencies through the emergency network. This is one of the our kind of a thought process, which has been going very effectively, and we have been able to kind of do a lot of transports through the hub and spoke model. So coming to this hospital, I think we have excellent doctors who joined, and we've already been kind of in Chennai, well known, and this hospital I'm sure will kind of will be able to deliver great, excellent medical care and very good results for the children as well as for the mothers who come to this hospital. Thank you.
Thank you.
Thank you.